Now, the burden of mental health disorders is very high, with limited access to available and affordable mental health services in Africa. From someone jumping off the bridge to drinking some form of poisonous substance, menace is becoming worrisome in Nigerian society. Many cases of mental health problems are being managed by psychiatrists, nurses, social workers, clerics, and traditional care attendants, leading to the diagnosis, treatment, and rehabilitation of patients. News Central's Bettina Nwelih has more.
With a population of over 200 million, Nigeria has fewer than 300 psychiatrists, accounting for a ratio of about 700,000 of the population per psychiatrist. Furthermore, 9 out of every 10 doctors in Nigeria are seeking to leave the country, and only 8 neuropsychiatric hospitals are available in the entire country, responsible for the professional training of psychiatric doctors as well as managing patients with psychiatric disorders.
So when you tell an average Nigerian or an average African man to, go ahead and check their mental health status, the answer they will give you is, am I mad, or when I'm not mad? Because there is that notion. And that had also formed a kind of stigma against mental health. And that, as a matter of fact, there is a stat that says that 1 in 6 of us will be affected by mental health related issue in a given week. The issue that mental health addresses affects the young, affects the old, the rich, the poor, and then even the people we think are like so normal that we might feel they don't have any issue at all.
The lack of coherent and comprehensive mental health laws and policies in Nigeria is another cause for concern. Nigeria's mental health legislation, the Lunacy Ordinance, was first enacted in 1916 and later renamed and amended as the Lunacy Act of 1958, which gives power to magistrates and medical practitioners to detain an individual suffering from mental illness. 6 decades after, the legislation has not been fully amended, as there was the passage of bills by the National Assembly in 2003 and also in 2013, but yet to be signed into law.
Both the public and private sector have to come into collaboration on this. From a government point of view, there's really need to emphasize on and even revamp the legislation around it, because the policy that guides managing health gets more attention. Group life policy gets a lot of attention, but the one around mental health and mental well-being, I'm not sure it has even been revamped in the last couple of years. There's some teams that actually became 20, 30, 40, 50% more productive just working from home. So flexible working, is something that, it's relatively newer in Nigeria, but it's been in place in a lot of global organizations.
Mental health problems are believed to be associated with some high-stress occupations, while evidence suggests that excessive demands of the jobs, coupled with low income, job insecurity, low status, and physical fatigue, contribute to mental health occupational hazards. Governments, corporate organizations, and other stakeholders will do well to prioritize mental health balance in order to increase work productivity and better manage the health of employees and employers alike. Bettina Nwelih, reporting for News Central.